All right, it's a little bit past the hour here, so we'll go ahead and get started. Looks like a couple people are still filing in. Luckily, we will record this webinar, so it will be posted on our YouTube, and we'll send it out either later today or early tomorrow. So the topic of the day is going to be changing behavior and removing barriers, and how HealthiestYou is going to be the front and center for that with your healthcare needs. So if you have any questions throughout the webinar, please utilize the questions tab. It's going to be on the right-hand side. Also, there's handouts there. There's 3 flyers. Please feel free to download those as we go through the presentation. But use the questions. We'll open it up for Q&A here at the end of the webinar. So we'll go ahead and get started. So changing behavior, right? How did this topic come up, and why are we doing this month? We're going to have the series of the webinars on a monthly basis, live national webinars. So the topic this month is behavior change, how HealthiestYou is doing that, and really bending the trend in healthcare. As we see here on the left-hand side, by 2025, premiums are projected to increase by 60%. And this is by the Kaiser Family Foundation. They also said that since 2005, the premiums have increased already 60%. So think of a 120% increase within a 20-year span. Those are pretty substantial premiums that us as companies, employer groups, are absorbing, right? And if we don't absorb all of the costs, what other companies are doing on the right-hand side is 1 of every 3 employers is increasing cost sharing for employees. So what does this mean? They're kind of switching more to an HSA or a high deductible plan and giving that copay, maybe increasing that copay for the employee and sharing that cost. And what HealthiestYou's main goal is to change behavior, right? We want people to start with HealthiestYou, so as we see these premium increases, hopefully we don't get that high by utilizing HealthiestYou as redirecting claims away from the traditional health plan. I'd like to start out with telling you a little bit about HealthiestYou and how we got to where we are today. We started with a company called Benefit. This was a bundling company. We leveraged a telehealth service, there's 401k, dental, vision, so on and so forth. And we realized throughout the years of the name changes you'll see here up top that the model really didn't work with changing behavior. There was a barrier in place, right? There was a copay involved of $30 to $40 to talk to a doctor, and people didn't want to pick up the phone and start that behavior change, because why would you change something that necessarily doesn't need to be fixed, but you can go see a doctor face-to-face for that amount of money, and you know that your issues are going to be resolved, right, at that brick-and-mortar consultation. Through the years, we evolved in HealthiestYou, and that's where we really took off. As you see here on the right-hand side, one of Inc.'s fastest-growing companies, 846, and also one of the greatest places to work here in Arizona. So I also like to start out with kind of talking about our core values, right? Here at HealthiestYou, we believe that there's possibility to change the world, right? Change the way people access healthcare and really put consumerism in the palm of their hands when it comes to any of your healthcare needs. So our core value number 9 is we are agents of change, therefore we embrace change. We are flexible and innovative, always looking for ways to improve our products, services, and the lives of those we touch. So just want to take a second here, and what our beliefs are here at HealthiestYou is really changing behavior, right? We're putting this product, this service, this benefit front and center so people utilize it. And you can't change the behavior if you don't know what you don't know, right? So that's our main goal here, is to remind everybody about the benefit on an ongoing basis. And we'll dive more into that here in a bit. So something strange going on here, right? There's another company that changed behavior. It almost feels like overnight, right? Uber. They took the guessing out of it. You call an 800 number, you don't know necessarily when the taxi's going to arrive, who's your driver, how much that fare is going to cost. Uber simplified that experience. They told you everything you needed to know. They told you who your driver was, when he was going to be there, what car he was going to be in, how much your fare would be from point A to point B. Really took the guessing out of it, right? And that's why everybody uses Uber now. It's almost a verb. And here at HealthiestYou, we're really trying to do that as well, right? We want everybody to have that consumerism in the palm of your hands. You know, what if I told you if you like to control everything in your life and you like to control your healthcare and you want that decision to be made for you and help you, HealthiestYou has centrally located that within an app and an online portal to have any of your healthcare needs, almost a healthcare ecosystem. All right, Dan, I don't have an app. I don't have a computer necessarily. Perfect. HealthiestYou was kind of built on an 866 phone number to really drive our behavior change at kind of the beginning and forefront before we reach that Inc. 500 list. So old phones, smartphones, you know, tablets, as well as computers. Sometime here in 2016, we're actually going to roll out our couch care initiative. So you're going to be able to sit at home and have that consultation in front of, you know, your big screen TV, the comfort of your couch at home. The 866 phone number works perfectly. My father actually used the service on Sunday. It was kind of ironic as he's had the service ever since I started working here. Never used it. Very opinionated and stubborn man. So he called first time 866 on Sunday. He spoke with the doctor, and it was funny. I kind of chuckled at the end of his consultation. He looked at me and he said, "Why haven't I done this before? And what have I been doing my whole life?" Lo and behold, my father did have a flu, and he did get a Z-Pak prescribed to him Sunday afternoon, and he's feeling a lot better by today, Tuesday. So again, how do we centralize that healthcare, and how do we put consumerism in your hands, in your employees' hands, spouses and dependents and well, everybody on the plan? We do that with our features, our apps, but one of our features that's going to redirect the most amount of claims from your health plan, that's going to be our 24/7 unlimited doctor access. So as I mentioned, my father had that consultation on Sunday. He was able to talk to a doctor from the comfort of his couch on his phone. He does not have a smartphone. It's, you know, he's one of those laggards. If we're still selling rotary phones, he'd have one of those, but he has a touch-tone phone. And he was able to talk to a doctor. And then the prescription savings, as I mentioned at the beginning, with the trends in healthcare and how things are going into that cost savings or sharing, if you will, with those HSAs and high deductible plans, we're also seeing a rapid increase in prescriptions. So the prescription savings is definitely going to be able to utilize if you go to the doctor and you get that prescription, even if it's not prescribed by a HealthiestYou physician, you can still leverage that prescription savings. There's also a procedure savings. Say the doctor says, "Dan, you need to go get an MRI. This could be severe." I could go on and price that out as well. And then I can locate providers. We'll look at that here shortly. And then health management content. So as we went through the history of HealthiestYou, you saw that there was all these names, and then there was HealthiestYou prior to HealthiestYou, right? So HealthiestYou was a wellness company, and our chief medical officer, Dr. Kelly Traver, actually has healthy content on the app. It talks about behavior change, right? A lot of her information is making small adjustments to your life or small changes for the long-term goal of behavior change, right? Because things don't happen overnight. People don't quit smoking overnight or start a new diet overnight. It's a lengthy process. So a lot of her information is about that. The members can also sync their medical benefits with their insurance plan. So before we dive into the telehealth, I like to kind of bring up a testimonial. So I had the privilege to meet Susan, this testimonial here. And as you're reading it, Susan called me. I met her at open enrollment. She called me and she said, "Dan, I hope you're having a good day. Can you sit down? I want to talk to you." I thought this was a little odd. So I started talking to her, and she told me about her experience. This is a very condensed version of her experience. But lo and behold, Susan had acute pancreatitis and acute kidney failure. If she didn't call, the medical staff at John C. Lincoln told her she would have indeed passed within an hour. So Susan also told me that she's a very stubborn lady. She's had the benefit for 2 years. This is the first time she's used it, right? It saved her life, right? So if Susan would have gone to her primary care instead of talking to a doctor, she might have not got to the ER in time, or she might have, but the primary care probably would have said, "This is severe. You need to go to the ER right now." One of our doctors was able to walk her through the symptoms over the phone and gave her his direct cell phone number as she traveled to the ER room. Very powerful, right, as we're talking about removing barriers. So a lot of people still don't want to, right? So we go into social norms. A lot of people want to follow everybody else. Who's jumping in the pool first? I want to follow because everyone's in the pool, essentially, right? So as we've seen here, and feel free to raise your hand if you've ever gone to a hotel and stayed at a hotel and seen one of these signs. But what the hotel industry did was they noticed that the behavior change wasn't happening with this sign that said "Save Our Planet." So right below it, you'll see that over 75% of our guests who stay in the room decide to reuse their towels a second day. Guess what that increased to? That increased to almost 70% that guests decided not to clean their towels. Decided to clean their towels. In turn, is saving our planet, right? There's gallons and gallons of water saved. So what if we change the topic over to HealthiestYou here on the right-hand side? And we could stay in the clean energy, social norms, or we could say that over 70% of our members who have HealthiestYou decide to call a doctor rather than driving one. Think of all that pollution we save, right? But they're probably not going to follow just to save the environment. They're going to follow because over 70% of their peers, their colleagues, everybody they're working with is using HealthiestYou, right? Those social norms are set. People want to follow what everybody else is doing in their space. And same thing with Uber. It didn't catch on right away, but now everybody knows about it. So the same thing we want to do here at HealthiestYou. And why do we want to save, pollution, save some travel? Because these face-to-face brick-and-mortar locations. In 2014, the average wait time for a primary care nationally, 18 days. Can you imagine waiting 18 days when you have your sinusitis or your son's sick at 2 o'clock in the morning? You're not waiting, right? You're going to go to the urgent care. In a lot of cases, that urgent care is going to be closed. And, there's a costly fee incorporated with that, as well as the emergency room. Costly, time-consuming, a lot of out-of-pocket spend as we're talking about the shift in healthcare costs with high deductibles and HSAs and so on. So with the quote earlier with Kaiser Family Foundation, how do we redirect a lot of these claims? We start with HealthiestYou. So when 2025 hits, maybe our employer group or our wives or spouse or whatever it may be, their increase isn't going to be as high because they're leveraging something to redirect those claims with a benefit that they're already utilizing, right? We just need everybody in the company to really adopt this behavior. And because there's so many reasons, you start with HealthiestYou. There's no claims, there's no travel time, no germs. You can say that there's no pollution. People don't have to leave work to go see a doctor, so on and so forth. So why do people use HealthiestYou? Well, simply because over 70% of our doctors can handle over 70% of issues handled face-to-face can be handled over the phone by our doctors. And this is by the Wellness Council of America. Additionally, JAMA came out and said it would be more towards 78% of those issues can be handled over the phone. So in the handouts on the right-hand side, you'll see a cost analysis. Great flyer. Feel free to share it with your employees. But it talks about over 50% of our top diagnosis. As you see here on the slide, here's only 9%. 9, actually. This is why our doctors are handling on a daily basis. Oddly enough, it mirrors the emergency room. So members are calling in. For example, my father called in with the flu on Sunday. He was able to get that Z-Pack. Our top 3 prescriptions are Augmentin, amoxicillin, and Z-Pack. So think of those issues, and you're calling in, right? You're getting these prescriptions right now, perfect time. Peak season, it is coming to the tail end of cold and flu and going into allergy season. Our doctors are getting called on a daily basis primarily for allergies right now. Oh, some of our members, the same thing like my father and Susan, who the testimonial we looked at. They might be stubborn. Their symptoms might progress. That allergy symptoms they were having just during the sinusitis. So feel free, remove that barrier, call HealthiestYou first and foremost when you're not feeling well. So who are the doctors I'm talking to, Dan? I don't know what I don't know, and I can't change what I don't know. So you're going to talk to licensed physicians that reside in the United States. 80% of our doctors are going to be ER doctors, then the rest are going to be sprinkled in. We have OBGYNs, ear, nose, and throat doctors, pediatricians. I'm a first-time parent. I have a little 2-year-old that's in daycare, and I tell you what, he's sick most of the time. It seems like every other month. So I leverage the physician network to talk to a pediatrician over the phone. In turn, I don't have to take time off work, and I can get his symptoms handled over the phone, get a prescription. He could be at daycare, healthy as could be. So you'll see there that the doctors get diagnosed, treat, and prescribe. And again, the largest telehealth network in the country. So we have over 2,000 doctors waiting for members to call on a daily basis. Think of your concierge doctor network right there in the palm of your hands. As I said earlier, this is a benefit for people that want to control everything in their lives, right? So we've centralized that, and you can control speaking to a doctor instead of traveling, going to their waiting room, waiting, and seeing the doctor face to face. So as I mentioned, some of those social norms prior with, who's hanging up their towel because they don't want it washed, the 75% of the other people are. Who's following what other people are doing? Well, a lot of our groups are already started, and a lot of other people have already started following. So the customer satisfaction here is at 97%. People are getting their issues resolved. Medical issues are resolved 94% of the time. So back to that testimonial, Susan, she was able to get her symptoms addressed, and the doctor said, you need to go to the ER immediately. So she did. In a lot of cases, that won't happen necessarily because they're going to be acute type illnesses, right? Our doctors are going to be able to handle those issues, get the prescription. In some cases, the doctor's going to say, this is virus, your fever is already fighting it, stay home, have some Tylenol, or whatever it may be, Campbell's soup, get some rest. And then a lot of cases, our members are calling here, you'll see Monday through Friday, 51% of the time. Think of all the productivity you could get back within your organization if your colleagues and staff are simply calling in to talk to a doctor between that time frame, those traditional work hours, right? Members are calling in and getting their symptoms addressed over the phone, getting their prescriptions, and then going to get those at lunch or after work. Changing that behavior. You'll see here the average callback time from a doctor is 9 minutes. I know I personally can't travel to one of those brick and mortar locations, let alone wait, right? My time's worth a lot too for me. So average callback time is 9 minutes. We do guarantee within an hour. As I mentioned too, we are in that peak season, so the average callback time might be a little bit longer, but it's still going to be a lot shorter than having to go to one of those face-to-face visits. And the average consult duration. So I heard it the other day. A member came and called me and she said, Dan, I want to talk to you about HealthiestYou. Previously, I'd go and I'd drive to my primary care. I'd wait 40 minutes and he'd come in, he'd see me for 2 minutes, and then he'd give me a prescription and walk out. It was over an hour and a half lengthy process from the commute to seeing the doctor, let alone having to wait for the prescription. And she asked, Dan, why did it only take 2 minutes, but yet your average consult duration over the phone is 13 minutes? Well, when they go to med school, the doctors go to med school, they're told that they can actually prescribe, diagnose, and treat about 80% of the time simply by reading your diagnosis, your symptoms, and also your family history. That's all they need, and they know. They know right away. They'll come in and ask you questions. Over the phone, you'll see that it's a little bit longer than almost that 2-minute, exchange. And that's because our doctors are going to ask more series of questions, right? Because it is over the phone. But to get over that barrier and talk to a doctor over the phone is just the first step. And that doctor is going to make you feel like a patient rather than see you for 2 minutes and walk out. Looks like a lot of good questions coming in. And a lot of people are downloading the app right now, and that's perfect timing. We're about to get into that. But before we get into that, we want to talk about our passion here at HealthiestYou. We really want to drive behavior change. And how do we do that? As I mentioned at the beginning, we tried different models. We tried a low utilization model with a high consultation fee. It didn't work. A lot of the other guys you'll see here, our competitors, That's their model, and that's completely fine. Our model is going to change behavior, it's going to change healthcare, and it's going to reduce those trends. As I mentioned, that 2025, it's coming around the corner, right? And 60%, premiums increase. That's a lot to absorb as a company. So behavior change does take time, and as you'll see there, that 58% of our groups that have been with HealthiestYou, not 58%, the groups that have been with HealthiestYou for over a year have actually reached, on average, a 58% utilization. So we'll see later in this presentation that sometimes that comes early in their adoption curve, or it comes later. But just know that this is going to be a long-term strategy. So again, when 2025 comes around, we don't have those crazy premium increases, or for that matter, maybe even next year, right? So our engagement pulse, how do we get utilization? What do? We do a lot of email marketing, and we really rely on our group administrators to relay the message, right? As I mentioned before, a member can't change what they don't know. So that's why we're continually sending marketing material, reminding. You'll see here that there's program reviews. So we actually just imported the March utilization, and we'll look at a report here shortly. But you can go on to your client portal and view how many people are using the service. Okay, and then when next year comes around, we know how many people used it last March, and we know why they used it: cold and flu and allergies. So maybe next February we could say, hey, remind, you have HealthiestYou. So they don't go create those face-to-face claims. So you'll all see these emails. We love sending them out. And we like to really be tongue-in-cheek almost with our email marketing, right? We like to be outsiders of the normal healthcare, bland email. So please feel free to forward these on. Anytime you get them, we also email our members directly. And then you'll see here the retargeting ads on the right-hand side. So a member goes on to HealthiestYou, but they go on to Amazon after that. They might get a retargeting ad to remind them about HealthiestYou. As our Chief Medical Officer, Dr. Kelly Traver, said, that it takes a lot of little things to change behavior. They just don't happen overnight. So these are our ongoing efforts of little things to help change behavior, remind, and simplify healthcare for our members. So we like to share a success story. I actually had the privilege to work with this client out of Wisconsin, the school district. But as we see here, they have an average 225 employees. Their doctor consultations, 177, which equated to 86% utilization. So what does this mean? Just think of 177 consultations. That could be a pretty substantial cost for this company if a lot of those are ERs or urgent cares or primary care. Those dollars add up. Luckily, this group was actually able to have a renewal that decreased. How does that work, right? So the school, the district, the superintendent actually gave raises with the remaining dollars to the teachers and staff. It was the first time in years. Great story. They were able to change their behavior. And what I really want you to take away from this, they did this their first year with HealthiestYou. So think of that, right? That compounded interest, as we saw in the last slide or 2 slides ago, the utilization. Our average book of business is 42%. We have some groups that are 2%. We have some groups that are 300%. This group was able to adopt it rather early. But when I think about compounded interest, the first year, you might have, let's say, 10% of your employees use the service. Well, that second year comes around, and what really happens, and people really adopt it, you get another 10%. So year 2, now you have 20%. And then it just keeps evolving, right? And we really need that behavior change to adopt, because 2025 is coming around, and that 60% rate increase is pretty substantial. So kind of piggybacking on that, the utilization report that we'll look at here shortly, but the higher your groups use it, the lower your healthcare cost. Pretty easy concept to understand, that we really want people to adopt the benefit, because not only for the employer group, it's going to reduce your claims increase or your premiums increase, if you will. But for the employee, what does it mean for them, right? Well, they're going to save their copay, or if they're on HSA, they're going to save a lot of dollars, and then they don't have to leave work, or they can have their child seen by the doctor, or their spouse, or whatever it may be. It's for the family, the members, that we can utilize this service. So I'm going to get into our smartphone. How do we get utilization? And what is the product, right? What is HealthiestYou? You guys redirect claims away from the health plan. There's telehealth. There's prescriptions. Well, we do a lot because we noticed throughout our name changes and our history that just one simple health, telehealth 866 phone number isn't going to drive behavior change. It's the belief and then our app right here and our features that really are driving change for our groups. So as you see here, our smartphone is available on the App Store as well as the Google Play Store. And again, connect with the doctor 24/7, 365, whether it's Christmas morning or even, a Tuesday afternoon, you'll connect with the doctor. You can find a provider, and we'll go into that here shortly. There's also a circles function. So think of this as, maybe a Google favorites, right? You're able to save your favorites. This is used greatly, especially if you travel, as well as our radar function. Dan, I'm traveling. I don't know where my nearest doctor is, urgent care, or I simply need sunscreen. I'm at the beach and I forgot it and I need to know where the nearest Walgreens is. You can use this radar function as well. You can compare costs for procedures, prescriptions, and then sync your insurance. Okay, Dan, so it's a great benefit. I'm busy, you're busy. How do we reach out to our members when they walk into an urgent care? Well, we created this geofencing technology very similar to AT&T, Retail Me Not, or even Starbucks. So a member walks into an urgent care. This is an example, and we'll do another example here shortly. We're going to notify them, hey, put that $50 back in your pocket or however much your copay is and take out your HealthiestYou app, because if this is one of those issues that can be handled over the phone, change your behavior now. So again, as I mentioned, our Chief Medical Officer, Dr. Kelly Traver, said there's a lot of little things we have to do to change behavior for a long-term goal. We did this as well with the prescription savings. This is a great way to remind the member about saving money on the prescription. They might be at a Walgreens and get this. They might not be there for prescription or whatever it may be, but they will also probably toggle that off, maybe decline that benefit reminder, but the next time they get sick, they'll call HealthiestYou, because it's just that ongoing reminding, HealthiestYou, HealthiestYou, and again, all those little things we're doing. So this is our in-network provider search. Members have the capability of searching where the nearest doctor is, viewing the star rating. As I mentioned earlier, I'm a first-time parent. I have a 2-year-old, and I wanted to know who his pediatrician was going to be. So I was able to pull it up here, see the star rating, how many years they've been in practice, what languages they've spoken, what school they've gone to. It was awesome. But what I really want you to take away from this is this little provider search right here. When members pull this up on their app, it says call doctor 24/7. So we have seen through the data that 44% of our members that are searching for a doctor choose to call a doctor 24/7 right then and there. Have that consultation over the phone. Because they're searching for a doctor, we kind of know, hey, call us first. So again, ongoing effort, reach out to the member at the time of need. So we'll go ahead and jump into the portal here. Looks like a lot of questions are coming in, so keep them coming. We'll answer a Q&A here in a bit. Just one moment, jump out and go into the HealthiestYou. So the HealthiestYou website is a great tool to use, whether it's during open enrollment or new employee orientation. Once you go to the HealthiestYou site, you can scroll down. Here we go. HealthiestYou is changing the way real people access healthcare. And that's our main goal. That's our belief. Here's our 3-minute overview video. You can see how people are adopting the benefit and what tools they're using and how they're using them. So what we do, here's more about our features. And then our mobile app. Again, the radar function. Great feature if you're traveling. You could pull up what's in your area, very Uber experience. Now let's say you walk into a pharmacy. Here's that benefit reminder, time and need, connect, see if you can price a prescription cheaper. Urgent care, same thing, real-time experience. Call a doctor. Again, hopefully they know about HealthiestYou prior to walking into that urgent care. But, I'm, very busy, right? We forget about things. We forget that we have benefits and things of that nature. So it's an ongoing effort because you and I on the phone can't always remind the member. So we'll go ahead and scroll up here. To access the member portal, you go to Access Member, and I'll open mine up. As you can see here, it has the weather. Kind of dreading the summer here in Arizona. It's already going to be 101 on Thursday, kind of scary. But you'll get a good quote here on the upper right-hand side. You can visit a doctor, locate providers, price prescriptions or procedures. And then here, these are going to be our videos by our Chief Medical Officer, Dr. Kelly Traver. You hit play, you go to next. There's a lot of great videos in there about behavior change. And then go in there and dive in and learn more. This one's about traveling healthy. And there's our Chief Medical Officer right there. And then latest news here on the right-hand side. You'll see a lot of information about rate increases, right? Premium increases, prescription increases. So that's why we're, addressing this behavior change before that trend hits. We really want to bend that trend here at HealthiestYou. You can access the functions on the left-hand side, radar, circles, apps, telehealth. Dan, I want to talk to a doctor. Okay, perfect. Here's my number. Hopefully my cell phone number is not in your phone, or if it is, feel free to call me. And then primary care, I would have gone there instead. I could start a consultation. We'll jump back. So that little survey I just took, what would I have done differently? We're going to go into the client portal now. So if you are a group administrator, please feel free to utilize the client portal. So many great features in here, but we're going to dive into the utilization report. Here we are. We have total members, total consultations. So here at HealthiestYou, as you can see, our utilization is very high. We've really instilled this within our culture, almost created a verb, right? If you're not feeling well, HY, use HY first. Call HealthiestYou first. And then from that survey that I just took on the member portal, well, we get all that data back. So we're going to report back that to you as a group administrator, and this is how much you would have saved, right? So it's going to see those plan savings. Our company has saved a substantial amount thus far in the year. Then there's going to be a nice printed version that you go on here and print, share it with your colleagues. Maybe you want to share it at a company meeting or an executive meeting of how HealthiestYou is impacting your healthcare costs and your employees are really leveraging the benefit there. So as it loads here, you're able to download the file and then view the PDF. You can see the locations of where people are calling and the complaints, right? Acute bronchitis, cough, influenza, see what was prescribed, and then the time of day. As we mentioned in those survey results, that 51% of our calls are done during the traditional work hours. So we really want to impact the productivity in the workplace as well. Then the total savings here, as you can see, it adds up, right? The more we can redirect, the more money you're going to save in terms your premiums hopefully will not have an increase. And your employees, again, more productivity in the workplace as well as saving their copay dollars. So that's kind of the flavor of the client portal. There's also a great feature over here, documents. So if you want to download those 3 flyers and the handouts on the right-hand side, you can also come download a similar presentation or any other flyer that you can share with your employees. So a lot of great tools on there. Please feel free to go on and utilize that. So we're going to jump back in the presentation here. One moment. A lot of good questions coming in, it looks like. All right, so this is a quick little quote that a little Deloitte consulting firm did last year. And what I really want you to take away from this is the projected telehealth visits. Compared to 800,000, it's supposed to be in 300 million in just a few years. Why is telehealth going to, evolve that quickly? Well, as we went to those trends and how HealthiestYou really wants to bend those trends, because the healthcare cost and system is going to just get so expensive, as we've seen with prescription increases, premium increases, so on and so forth, that HealthiestYou is really here at the forefront, and you've all adopted this benefit, and we want everybody to change their behavior and adopt it together so we don't have to have those rate increases, and we can reach these 300 million e-visits. So I like to talk about this as healthcare is road less traveled, right? As I mentioned, my father used the service on Sunday. He's going to be one of these laggards. And this is the law of diffusion of innovation. Typically looks like a little hill or mound, but this is the HealthiestYou version. And the laggards are going to be the people that necessarily, they might still have touch-tone phones. And to my dad's point, he has a touch-tone phone because they don't sell rotary phones anymore, right? But you'll get the early innovators. So the early innovators are going to be you and I, the ones on the phone that want to learn more about HealthiestYou. We're the enthusiasts. And then you'll get the early adopters. The early adopters are going to typically be the people that come in and say, hey, I had an experience. This is how it went. It was awesome. And they're going to be the ones that share their testimonials. After that, the early majority is going to follow because they want to know how it went, right? They're a little skeptical at that time. Then they're going to adopt. Right here after the early majority, and I would say that Slinger School District is right around there, the group that had the 88% utilization that we went over, they're right around there. After there, it's all downhill. You're going to pick up everybody. Everyone's going to want to be a part of the movement, the party. Kind of staying with that concept, being a part of a movement, right? Here's a little video I like to share, and it's very simple, right? You have this gentleman in the field. He's having a good time. He's dancing, and he believes in something. He just, maybe it's being free or whatever it may be, but he's looking for followers, right? Let's say this is the group administrator that comes in, and this could be you and me, right, on the phone. And we're dancing. We believe in HealthiestYou. We believe in changing behavior, and we're going to start dancing because we know that change is inevitable, and it's going to happen. As you saw there, the gentleman in the green shirt, he just waved some people over. He wants to tell people about this benefit. And I hope everybody on the phone feels the same way, right? You want to tell people that changing behavior can have an impact on your healthcare spend, and also co-pays for the employees. So another gentleman walks in as the law of diffusion of innovation. You know, we have the early adopters. They're going to come in and they're going to experience it too. This gentleman in the black shirt, he might have a great testimonial, right? Share that within your company because it's only going to evolve and more people are going to be a part of this benefit. As we see here, the crowd's growing, right? People want to be involved. They really want to make change because, as the social norms told us, that people want to follow what other people are doing, right? They're not going to save the water just because other people want to save the ecosystem. It's because other people are following. As we see here, the crowd, it's getting a little bit bigger, right? I want you to remember that this started with just one guy, just dancing, doing his thing, minding his own business. And look at what's evolved to. The social norms have showed that people want to follow what other people are doing. So what I really want you to take away from this, besides it's a great video, is let's work at this together, because when 2025 comes, let's all be dancing like this, right? We are part of a movement. We are part of a change, right? Our renewal hits. We have everybody adopting this as a benefit. Let's say this is our entire staff, or let's refer back to that Slinger. There's maybe 177 consultations right there. That is a lot of money that was just redirected away from that health plan. As you can see, the crowd is evolving. People are getting up now from sitting so close to it to be a part of this. The laggards are coming in. All the late adopters are being a part of it. And it's all downhill from there. So think of the future, right? Everyone's going to be using the benefit, and they've just changed their behavior. It's a great video I wanted to share with you today of how all it takes is one. All it takes is one person in your company. Hopefully that's you on the phone, or maybe somebody else in the company that has a testimonial, but share those testimonials within your company. So we're going to go. We're going to release the Fitbit winner here in a bit, answer some questions, open it up for Q&A, and then what I want you to do as well after this webinar is set positive goals, attainable goals. One of my groups, they reached out to me the other day and they said, Dan, I tried something and I think it works. And I want to share with you today is because all this group administrator did was try to get 5 people to download the app every week, just 5 new people. She's about 80% of her entire employee population has downloaded the app. It's their first year, and they've already reached 50% utilization within the first 3 quarters of 2016. And that's all she did. All she did was try to get 5 people. You know, that seems very small and trivial, right? But, you know, it's those little things that we do to make that long-term goal. So we'll open up for Q&A, and then we'll answer some of these questions. Again, thank you everybody for attending the webinar today. I greatly appreciate your time, and I know everybody is very busy.